So at CMC, it's the only hospital in the state that actually has a fellowship-trained orthopedic trauma surgeon on call 365 days a year. So you have that subspecialty care, which helps our level 1 trauma center take excellent care of these patients who come in injured, whether it be from a lower energy fall or from a high energy accident such as a four-wheeler accident or a motor vehicle accident. So, I mean, an orthopedic trauma surgeon is a surgeon who, has completed 5 years of orthopedic surgery residency like all the other general community orthopedic surgeons that are out here in the region, but then the orthopedic traumatologist has went and done extra training, subspecialty training in traumatology. So the orthopedic traumatologist, again, we take care of fractures, from the clavicle and shoulder all the way down to the wrist, and then also from the pelvis and hip all the way down to the feet and toes. This is all we do, is what we specialize in. So we'll take care of the sort of routine fractures, but also the very complex fractures. We have established an orthopedic trauma walk-in clinic here at CMC at General in our orthopedic trauma office, and we do that as a service to the community to help expedite orthopedic care for patients who get injured. And these can be anything from sprains or strains that occur in sporting events to ruptures of an Achilles tendon or patella tendon, again, sort of the weekend warrior type injuries, to some minor fractures that maybe a patient is seen at an outlying smaller hospital that doesn't have orthopedic care, or even at an urgent care. And again, we here at the Orthopedic Trauma Group, we take care of patients from newborn age who sometimes unfortunately have fractures from the birthing process all the way to geriatric patients that are in their hundreds. It could be just a ground level fall, or it could be sometimes they have osteoporosis, and from that they have a twist and turn the wrong way and the hip breaks and then they fall. So sometimes they fall first and then break the hip, and other times the bone breaks and then they fall. In the younger population, it is a lot of four-wheelers and side-by-sides, motorcycles in the summertime, car accidents, a lot of the outdoor sporting events that we see, and activities such as snow skiing in the winter time, mountain biking. Of course, we see injuries from that. And then in the pediatric population, it could be just out playing, or monkey bars. Trampolines are a very common cause of injury. And then, of course, falling off ladders and roofs are also very common. The most rewarding thing about being an orthopedic surgeon, orthopedic traumatologist, and the reason I went into trauma, is because you can take patients who have unfortunately had a bad mishap or an accident, and it may be at work or even on their house. They could be fall off their roof, or they could be in a car accident or motorcycle accident or a four-wheeler accident, and they come in and this could be we see patients with not just a broken wrist or a broken hip, but also ones who have, we call polytrauma patients, or patients who have broken potentially all four extremities and their pelvis, and we take care of those patients. And to watch them go from being that severely injured to come back to your office and 3 months later walking is just an amazing thing to watch and see, and I'm grateful to help patients do that.